Have you ever thought about what really happens inside your body each time you masturbate? Many men don't realize that their prostate experiences both immediate and long-term changes during and after ejaculation. Here's something even more surprising. Some of these changes can be beneficial, while others might raise concerns if ignored. In this video, we're diving into 6 key changes that occur in your prostate when you masturbate. From shifts in blood flow and hormones to potential effects on long-term prostate health, these changes are crucial for how your body functions as you age. By understanding them, you can make more informed decisions about your health, habits, and future well-being. Stick around until the end, because you'll not only learn what happens each time you ejaculate, but also how these changes impact your prostate over time. Some of these insights might completely change the way you think about your body and could even help you prevent serious health complications in the future. Let's get started. Number 1, impact on prostate cancer. One of the most discussed topics regarding masturbation and prostate health is its potential role in reducing the risk of prostate cancer. Over the years, various studies have suggested that regular ejaculation may help clear out carcinogens and inflammatory agents from the prostate, potentially lowering the risk of developing prostate cancer later in life. The reasoning behind this is pretty straightforward. The prostate produces seminal fluid, and over time, it can accumulate toxins, metabolic byproducts, and excess hormones. If these substances aren't regularly expelled, they may contribute to cellular damage and inflammation, both of which are linked to an increased cancer risk. Some researchers believe that frequent ejaculation helps flush out these potentially harmful substances, keeping the prostate healthier. For example, a well-known study by Harvard researchers found that men who ejaculated at least 21 times a month had a significantly lower risk of prostate cancer compared to those who did so less frequently. While this doesn't mean every man needs to hit a specific number, it does suggest that a regular pattern of ejaculation could be good for prostate health. However, it's important to note that this is just one factor in the bigger picture. Genetics, diet, lifestyle, and overall health all play significant roles in prostate cancer risk. Take James, a 74-year-old man with a family history of prostate cancer. Worried about his risk, he started looking into ways to improve his prostate health. He found that maintaining an active sex life, along with good nutrition and regular checkups, could help lower his risk. After consulting with his doctor, he made some simple but effective changes, including more frequent ejaculation, a diet rich in cruciferous vegetables, and an exercise routine aimed at supporting hormone balance. Over time, he noticed improvements in his overall well-being and felt more confident about his health. That said, ejaculation alone isn't a guaranteed way to prevent prostate cancer. It should be viewed as one of many lifestyle factors that contribute to better prostate health. Eating a healthy diet, managing stress, staying active, and getting regular prostate screenings are just as important. Number 2, temporary reduction in prostate congestion. One of the lesser-known benefits of masturbation is that it can help clear out excess seminal fluid that builds up in the prostate. This process, sometimes referred to as prostatic drainage, is important for maintaining prostate health. When you ejaculate, the prostate releases this buildup, reducing internal pressure and potentially lowering the risk of discomfort and inflammation. For most men, this means experiencing relief and relaxation after ejaculation. However, for others, especially those who don't ejaculate often, this buildup can lead to temporary congestion, which may cause mild pelvic discomfort or an increased urge to urinate. This is particularly true for men with benign prostatic hyperplasia or chronic prostatitis, conditions where stagnant fluid in the prostate can be irritating. Consider Richard, a 72-year-old retiree who hadn't been sexually active for months. He began to notice a dull ache in his lower abdomen and frequent nighttime urination. His doctor explained that his prostate was experiencing mild congestion due to a lack of ejaculation, which was causing increased inflammation and pressure on his bladder. To his surprise, the doctor recommended regular ejaculation to help ease the buildup and improve his symptoms. After following this advice, Richard noticed a significant reduction in discomfort and fewer trips to the bathroom at night. This doesn't mean that all men need to stick to a specific frequency, but it does emphasize an important point. Ejaculation can be a natural way to relieve prostate congestion. However, if you experience discomfort even after ejaculation, or if the relief is only temporary, it could signal an underlying issue that needs medical attention. The main takeaway is that for many men, moderate masturbation might be a simple way to support prostate health and alleviate unnecessary discomfort. Number 3, hormonal shifts in testosterone regulation. When you masturbate, your body's hormone levels fluctuate, particularly testosterone and dihydrotestosterone, DHT. These hormones are essential for prostate function, muscle strength, and overall male health. While testosterone naturally rises and falls throughout the day, sexual activity can cause a temporary drop in its levels right after ejaculation. For younger men, this drop is hardly noticeable because their bodies quickly replenish testosterone. However, as men age, testosterone production declines, and frequent ejaculation can lead to temporary dips in energy, motivation, and muscle recovery. This is why some men, particularly those in their 60s and 70s, may feel more fatigued after masturbation than they did when they were younger. Fortunately, this decrease is short-lived, and in most cases, testosterone levels bounce back to baseline within 24 hours. Then there's DHT, a more potent form of testosterone closely tied to prostate health. While DHT is crucial for normal male development, too much of it can lead to prostate enlargement and even hair loss. Some studies suggest that frequent ejaculation might help reduce DHT buildup, potentially lowering the risk of developing benign prostatic hyperplasia over time. However, finding the right balance is essential. Too little DHT can impact libido and overall vitality, while too much may contribute to prostate problems. For example, Frank, a 68-year-old man, had been feeling unusually sluggish for weeks. He noticed a gradual decline in his energy and a slight dip in motivation. After consulting with his doctor, he learned that his frequent late-night masturbation habits might have been disrupting his testosterone balance. By adjusting his routine to include better sleep, strength training, and a nutrient-rich diet, he was able to restore his energy and maintain a healthy hormonal balance while still enjoying a normal sex life. For most men, these hormonal shifts aren't a major concern, but it's important to be aware of them as you age. Understanding the roles of testosterone and DHT in your body can help you make more informed decisions about your habits and overall health. If you experience persistent fatigue, low libido, or changes in muscle strength, it might be worth discussing hormonal balance with your doctor. Masturbation itself isn't harmful, but like everything else, moderation is key, especially when it comes to maintaining healthy hormone levels and supporting long-term prostate health. Number 4, increase blood flow to the prostate. One of the first things that happens when you masturbate is a surge in blood flow to the prostate. This is part of your body's natural response during sexual arousal and serves an important function. The prostate gland, located just below the bladder, is responsible for producing seminal fluid, and when you become aroused, it receives a rush of oxygen-rich blood to support its role in ejaculation. For most men, this process occurs without any noticeable discomfort. However, for some, particularly those with an enlarged or inflamed prostate, this increased blood flow can lead to temporary swelling and pressure in the pelvic area. That's why some men feel a sense of fullness or mild discomfort after ejaculation, especially if they already have conditions like benign prostatic hyperplasia or prostatitis. Take George, for instance. At 74, he had been managing mild prostate enlargement for years. Most of the time, it wasn't a problem, but he started to notice a dull ache in his lower abdomen after ejaculation. Initially, he brushed it off, but over time, the discomfort lingered longer, making it hard for him to sleep. Eventually, he consulted his doctor, who explained that the increased blood flow during sexual activity was temporarily inflaming his already enlarged prostate. The doctor reassured him that, in moderation, ejaculation was still beneficial, but he also suggested hydration, dietary changes, and pelvic floor relaxation exercises to help reduce post-ejaculation discomfort. For most men, this temporary swelling isn't a cause for concern. It's simply how the body manages blood circulation. However, if you experience prolonged discomfort, difficulty urinating, or ongoing pain after ejaculation, it's a good idea to consult your doctor. While masturbation itself doesn't cause prostate issues, underlying conditions like benign prostatic hyperplasia or prostatitis can make any after effects more noticeable. Being aware of how your body reacts can help you make smarter health choices and avoid unnecessary discomfort. Number 5. Impact on urinary function. For many older men, urinary health becomes an increasing concern. Interestingly, masturbation can affect how well the urinary system operates. Since the prostate is located just below the bladder and surrounds part of the urethra, its condition directly influences urinary flow, urgency, and frequency. When you ejaculate, the prostate contracts and then relaxes, which can lead to a temporary increase in urinary urgency or a feeling of incomplete emptying, especially if the prostate is already enlarged. This is particularly relevant for men with benign prostatic hyperplasia, a common condition where the prostate enlarges with age and compresses the urethra, making urination more challenging. Some men notice that after ejaculation, their urine stream is weaker, or they feel the need to urinate multiple times in quick succession. This occurs because the muscles controlling the bladder and prostate undergo a brief adjustment period after sexual activity. Take Robert, for example. At 70, he started experiencing more frequent nighttime urination. Initially, he thought it was just part of getting older, but after discussing it with his doctor, he learned that his prostate was slightly enlarged and affecting his urinary control. He also noticed an increased urgency after masturbation, but struggled with a weaker stream. With this newfound understanding, he adjusted his hydration habits, limited caffeine and alcohol, and tracked when he experienced these symptoms most. Over time, he found ways to manage his urination patterns more effectively, leading to more restful nights. However, for men without significant prostate enlargement, masturbation may actually help relax the pelvic muscles and improve urinary flow in the long run. Some urologists even suggest that regular ejaculation can keep the prostate more flexible and reduce stagnation that may contribute to inflammation. The key is to listen to your body. If urination becomes increasingly difficult or uncomfortable after ejaculation, it could indicate an underlying issue that needs medical attention. While masturbation can influence urinary patterns, its effects vary based on prostate health, hydration levels, and overall lifestyle. If you notice changes in your urinary function related to sexual activity, it's worth discussing with a doctor to determine if it's normal or if further evaluation is needed. Maintaining a healthy balance in all aspects of life, including hydration, exercise, and prostate care, can help ensure stable urinary function as you age. Number 6, circulatory benefits of blood flow regulation. One of the lesser-known effects of masturbation is its impact on blood circulation, especially in older men. Every time you engage in sexual activity, whether alone or with a partner, your heart rate increases, blood vessels expand, and oxygen-rich blood circulates more efficiently throughout your body. This temporary boost in circulation can provide mild cardiovascular benefits similar to light exercise. However, for men with pre-existing heart conditions, high blood pressure, or circulatory issues, the effects can be more complicated. For some, masturbation acts as a natural stress reliever, helping to relax blood vessels and lower blood pressure in the short term. This is because sexual activity triggers the release of nitric oxide, a compound that improves blood flow by dilating blood vessels. Studies have even suggested that regular sexual activity may support heart health by reducing stress-related inflammation and promoting better circulation. That said, if you experience dizziness, chest discomfort, or irregular heartbeats after ejaculation, it could signal an underlying cardiovascular issue that needs medical attention. Consider Alan, a 73-year-old man who led a relatively active lifestyle but began noticing occasional dizziness after climaxing. Initially, he brushed it off, thinking it was nothing serious. However, after experiencing a particularly intense episode of lightheadedness, he decided to talk to his doctor. Tests revealed that his blood pressure tended to drop slightly after sexual activity, which explained his symptoms. With a few tweaks to his routine, like improving his hydration, making dietary changes, and spacing out intense activities, he was able to enjoy a normal sex life without unnecessary worries. On the flip side, Poor circulation can lead to erectile dysfunction, a condition that affects a significant number of men over 60. Some may notice a weaker or delayed erectile response, which can indicate reduced vascular function. Since achieving an erection relies on proper blood flow, any circulation-related issues, such as high cholesterol, arterial stiffness, or diabetes, can impact sexual health. Some doctors even consider erectile performance as an early indicator of heart health, so changes in sexual function shouldn't be overlooked. While masturbation alone won't dramatically boost circulation, it can be a part of a broader strategy for maintaining cardiovascular wellness. The key is to listen to your body. If you ever experience dizziness, fatigue, or unusual heart palpitations after ejaculation, it's worth getting checked out. Heart health and sexual health are closely connected, and keeping your blood pressure, cholesterol, and circulation in check will benefit both. Final thoughts. As we wrap up this video, take a moment to reflect on the 6 changes we've discussed. What resonated with you the most? Did you recognize any of these effects in yourself, or gain insights into how your body responds to sexual activity as you age? The truth is, our bodies continue to change over time, and understanding these natural processes allows us to make more informed decisions about our health and well-being. Masturbation is often misunderstood, but as we've seen, it directly impacts prostate function, hormone balance, mental health, urinary patterns, circulation, and overall well-being. The main takeaway is that, like everything in life, moderation is key. Paying attention to how your body responds and making adjustments when necessary can help you maintain a healthier and more fulfilling lifestyle. If something doesn't feel right, don't hesitate to seek medical advice. Your health is too important to ignore. We'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to apply it in your life. Your thoughts are important to us, so don't hold back. Reading your comments motivates and encourages us greatly. If you enjoyed this video and found it helpful, please like, subscribe, and share. Your support helps us keep creating valuable content to inform and inspire you. Thanks for watching, and we look forward to seeing you in the next video.